Afternoon, everyone. So thrilled that you all could join us. I'm super excited to be here and a part of a very critical conversation that I think is very necessary. And I am sharing the platform with some beautiful women who are doing some incredible work. So I want to start off by introducing myself. I'm Dr. LaWanda Hill, she, her pronouns. I am a psychologist, consultant in curative spaces, and also a staff psychologist at Stanford University. Ironically, I'm also sharing the panel with two lovely psychologists who I work alongside at Stanford University. I want to introduce them. We first have Dr. Helen Hsu, who is a phenomenal psychologist, a former president of the Asian American Psychological Association, as well as a staff psychologist at Stanford. And then we also have Dr. Megan O'Reilly, who is the owner and CEO of Inherent Value Psychology, and also a staff psychologist at Stanford University. So we are repping Stanford today, so it seems. I wanted to take this time to, really dive. It's so critical right now. I saw this blog the other day that said nobody prepares you in grad school about how to treat clients amid a pandemic. And I think that is very much so.
The live button again, I'm noticing people saying they're not seeing it.
All right, I'm going to do a check here because I don't know. Technology is not being my friend. Can everybody hear me? If you can sound off and let me know if people can hear me and see me, that would be awesome. Helen, if you could check that for me, let me know. Can people hear and see me? They can? Great.
I think so. And the chat's looking good.
Okay, cool. So let's go ahead and hop into it because we have some critical questions that we need to answer. I've introduced you all. I'm very excited to be here with you. Let's talk COVID-19 and clinicians. We're on the front lines right now. Nobody prepared us to be on the front lines, but we are there. And I wanted to pose this question to you, Dr. Hsu. I'm wondering, what has it been like? What have you seen? What's on the front lines? What's been illuminated for you and become very clear right
now? I'm sure my experience is a lot like what a lot of our audience is, that we're definitely seeing not only the normal levels of anxiety and stressors. Old traumas are being triggered, new, very serious stressors around illness and economic have come up. Social determinants of health and mental health that we've always known are now in sharp relief and definitely all pressing in on people that I don't know if we've ever encountered most of the time in our previous work. And to add to that, we're all in it with everyone that we serve and that we teach.
So you say this idea, things are being illuminated, past traumas are being activated, things that we've already been experiencing, like social determinants of mental health. I want to take, because that's some of the things that I've been seeing as well. And I want to illuminate that a little bit more. So can you say a little bit more about some of the social determinants of mental health that you feel like this pandemic is really illuminating and activating right now?
I mean, definitely we've all seen very much, there's things we expect, like people who are immunocompromised, coming to the ableism, may not have thought into our case conceptualizations, economic instability that had negative impact on Black and Brown communities, lower income communities, who still has a job, who is working in high risk and can't have the option of staying home as some of us do. So we're definitely seeing a lot of that. Are people being stuck in home situations as they're sheltering that are not safe for them? Domestic violence, child abuse has escalated in terms of the culture. And, we serve college students. We have some students going home who may be queer or have other unsafe family situations that this wasn't their plan for this stage in life, and now they're finding themselves there and a little stuck.
So what I'm hearing you say, and correct me if I'm wrong, is like a lot of our people who are very vulnerable, we're seeing those vulnerabilities being exacerbated right now. And we're seeing some of the vulnerabilities that may or may not have been on display being screaming loud and clear right now. So then I guess then the question becomes, so we have this idea of, I'm hearing inequity, I'm hearing privilege, I'm hearing people in different positions who are much more vulnerable to being hit in a certain type of way, marginalized communities. How do we react? Like, how do we respond? How is it that we can hold space for people and help them manage this on like a very global level where we weren't prepared in a lot of ways to be able to manage this?
Yeah, right. I mean, this is the piece for us. We're all in this ourselves, you know, and definitely special populations that we may hold, like as an Asian American, with the rise of xenophobia and sort of the blaming and racism, markedly, as someone who has elderly family members you caretake for, other people are caretaking for children, doing homeschooling. So we're all in this too. There's a lot of good work that's been going on out there about self-preservation of health. You know, very fundamental things about our sleeping, our health, our routine. But I also want therapists to really think about the long term. What are our growth edges, right? Not everyone here necessarily has specialized or had training in a lot of trauma or grief or responding to racism. May or may not have experience with some of the things coming up. And so where do we need support? You know, a space like this, or this may be a time to consult or contact an association, get resources like to support this work and support us while we're doing this work.
I think what I'm hearing you speak to is this ideal of cultural humility, like being on display very loud and clear of like the things that we've heard about us being humble about things that may or may not impact us because we're in a privileged position or we have a little bit of distance from these communities. And not that people who are not privileged aren't being impacted, but what I'm hearing is really this idea that we have to be more intentional now. If we have growth edges, even more so than now, how do we, you know, attend to those growth edges? How are we consulting with people? How are we reading up on the literature? What resources are we utilizing? What theoretical approaches that are working, but maybe working prior to, that aren't working now that we need to kind of expand, right? And kind of like what we saw at the beginning of this whole, when we were going live, is this idea of like flexibility. You know, Dr. O'Reilly said that flexibility is the new normal, or something to that extent. And even more so than now, we have to be flexible in our approaches to treatment because what has worked prior to, we're dealing with a completely different set of circumstances, and that may or may not have a lot of utility. So I want to pose this question to the both of you. What theoretical approaches are you drawing from right now that you're finding that are helpful, that we can kind of share with our clinicians? And then I also want to figure out what has been some of the limitations in which you have to become more creative in addressing these concerns.
Want me to go, Helen? I'll take a dive at it. There's two theoretical orientations that I think are particularly timely for this new zeitgeist. One is TFCBT, trauma-focused CBT. Although it was originally created for traumatized children and adolescents, I think the three phases that it uses is just really anchorable for clinicians, but also structured for clients. So phase one is just coping and grounding. Phase two is telling the trauma narrative. And so at the time of COVID, it could be, what are you telling yourself about what this means for you and your family? What is the actual narrative that you are getting bombarded with the news? And then what are the problematic behaviors we see coming up? Are you hoarding things? Are you steeped in scarcity culture? So that second phase is huge. And then the third phase is closure, kind of relapse prevention and grounding. And so I think TFCBT would be good for everybody. The other theoretical orientation, and I would love to hear people sound off in the poll or in the chat, that I don't actually use, I remember reading about and be like, oh, that's nice, but it's actually existential theory. I think when large things that are out of our control happen, existential theory takes a more philosophical approach, but still looks at human distress in terms of these human conditions. So meaning, purpose, responsibility, the satisfaction in life. So this approach might look like, if you're having negative reactions, what responsibility do you have? I think right now responsibility means social distancing, wearing masks, following CDC requirements, because it's not just you, it's also your place in the larger humanity. And I think having a space for those larger, hairier, at times darker questions. Existential was built for that, because you're not going to have an answer, but you can help them, guide them to creating their own study guide to develop their own answers.
I like both of those. I think one of the things that this is illuminating is like people's past trauma that may be unresolved. So I really like the approach that can you say it again so that we
TFC, trauma-focused CBT.
Okay, so trauma-focused CBT, which I can definitely appreciate for people who are really dealing with live, trauma that's being activated because they're back in the home, they feel restrained, or they're back in problematic environments. I do agree that existential theory is, we all have existential crises, and this is illuminating that even more so now. So I think that is something we can definitely draw from. Did you have anything to add from that, to that, Helen?
Well, I wanted to mention there was how we take care of ourselves, right? That's a piece too, is so some of the things, yes, absolutely, trauma-focused CBT. I've been said to practice a sort of narrative-flavored CBT, because I think narrative therapy, making meaning out of all of this, is really bring, again, a sense of purpose or structure. Existential work and, Buddhist psychology is very similar in philosophy as to what sort of, how do we sort of roll with and surf through and accept some of what's happening instead of trying to fight against what is like unstoppable, out of our immediate control. It reminds me a little bit of, one of my subspecialties is grief work, that we are all dealing with some losses now. We're all dealing with expiatory loss, that there's a lot of grief coming. And as a therapist, one of the challenges in grief work is taking care of ourselves, providing support for something that's not fixable. And that's difficult. Important time for ourselves to really concentrate on the fundamentals of like, how are we holding all the stress in our bodies, right? How many of us are not sleeping well, are not eating right, are just tense, juggling childcare and working and all this. A small thing, besides my workouts, is I joined a hashtag writing medicine, just a writing group for healers that meets on a Saturday morning, just to have that space with other healers. And that's been really helpful. So kind of finding a space for times. I think our normal coping mechanisms are not quite sufficient.
So I'm hearing narrative therapy, which is good, because I think giving people the empowering people to be able to tell their own narratives and their stories, because everybody's narrative is different, particularly if you're coming from different environments and different circumstances. So I'm hearing narrative therapy, I'm hearing existential, trauma-focused CBT, and then also grief. I think grief as a framework is very helpful right now, because one of the things that I've posited and put forth is this idea that a lot of what we're experiencing, the heightened anxiety, the irritability, the loneliness, the low mood, is reaction to grief, because we're losing a lot. We're losing our sense of autonomy. We're losing our sense of control. We're losing our, access to people when we want them. So I definitely think having a grief model is very helpful for people. I want to get into the self-care in a few moments, but before that, I want to pose to you all, we have these theoretical approaches that we are using. What are maybe some of the limitations of the current approaches that we've been utilizing, and how do we pivot to be able to meet the times? What are some of maybe the limitations of trauma-focused CBT or grief therapy that are just not really addressing the issue, and how do we pivot to be able to find the approaches and the resources that could meet the issue?
One of the limitations I'm running into daily with clients is, even if they did have a robust coping plan or strategy, or they're familiar with coping, a lot of it required the outdoors or other people. So we're having to get creative on how to look inward and build up some new resources, how to get savvy, how to use technology to continue that connection. Dr. LaWanda, I love your piece about socially distant but still connected. So how to reframe it in the mind so that the behaviors can follow. So looking inward, getting savvy, refurbishing old habits and habits from the past that didn't require anyone else or anything else. and kind of just really working that creativity muscle. So redefining coping when you're kind of caged in a little bit more.
Right. So I think that like maybe expanding the narrative to include more things.
Redefining.
Okay. Yeah. So I want to make certain that we, in terms of time, we're probably at about 10 minutes out, and I really want to spend some time talking about clinician self-care, because I think that's so important right now. We're definitely on the front lines, definitely feeling it. I can feel it in my body of just like emotionally holding more. I had a 4:00 appointment before this, and then I have an appointment after this. So it just feels like it's consistent, like it is nonstop. And so I am wondering, like, how are we coping? How do we cope? And this question is posed to both Dr. Hsu and Dr. O'Reilly. I'm sorry. How do we cope during this time of COVID-19 when we are holding space for everybody and still trying to hold space for ourselves?
I'll go for it. So coping for ourselves as the clinician is primary. I think talking about COVID and talking about clinician self-care is one and the same. We can't hold space for each other or for others unless there's somewhere for us. And I've been kind of archiving a lot of the different resources, and I'm starting to see some themes emerge across organizations, social media, and such. And the three things that I'm noticing that clinicians can do to cope for themselves, number one is to stay connected. There's either consultation groups or family members or partners near and far, but to stay connected somehow with both social and outside of work, but also within work. So you can consult about telehealth, like we're going to talk in a later panel about billing, all those things. We've got to stay connected. The second theme is moving your body. Staying embodied, staying with some type of movement practice. It doesn't have to be exercise, but we all know the benefits of exercise.
Right.
It can be a yoga practice. It can be a little bit longer shower for those of us that are in environments. Just giving us some more grace and privilege and permission to do what you need for your physical body. And then I would say the third thing for clinicians is a little bit more cognitive, which is your own letting go of how things were. A lot of things coming up in the literature is about this isn't a vacation. This isn't temporary. There's some good literature that says when we know when the finish line is, we can pace ourselves better. But when there's no finish line, we don't quite know how to pace. And so holding that ambiguity and being able to roll with our own feelings of uncertainty actually gives us a little bit of a sketch of how to hold it for clients. I had a supervisor at Ball State, Payee, if she's watching, she said, knowing your own path helps you lead others. So it's not the blind, just leading the blind. So having our own practice is going to be so much more better for us to be able then to facilitate that wellness for others.
I like that. I really like that. It's so rich. I really resonated with the longer shower. You don't recognize just how much like the time to just be and not like take those moments. What I'm hearing is take the extra moments that you have, even if it's in the shower, even if it's, I'm going to take a moment to wash the dishes and just be mindful. One of the things that I've been doing from one of Isela who works with us at Stanford was, but as much as I wash my hands, I am saying affirmations and saying prayers for people as it comes up. We're washing our hands often, we're sanitizing often, and I take that as a moment to either say an affirmation to remind myself or say a prayer for people who I feel are impacted in different types of ways. And so I think that what I'm hearing you say is just being creative about how do we take these extra pieces of time to kind of like turn inward and attend to ourselves, and then use that as a mechanism to attend to our clients.
Yes.
Want to add anything?
Well, everything feels in chaos, right? And so we're always trying to teach grounding skills, right? Just even if it's just that moment of mindfulness while you wash your hands, or like the grounding, but for ourselves as well. I find myself, I need to like run to the backyard and look at something real before I come back to my Zoom session. I've been gardening more and, really thinking about getting my hands dirty, thinking about what it means when cuttings regenerate into new life. What is it that we're trying to do here? And, some of the resources I'd added to the links are just all the ways that other people have created good things that are helpful. The radical healing work that some other psychologists are doing about healing, when your clients may be suffering from not only all this stress, but maybe racism too, and maybe yourself as well. Resources in other languages, right? Like, we don't know all the things, but it's been really beautiful to see the mutual aid that has come out and to really take some time to explore.
I want to touch on that and wrap us up in that regard, because we are seeing, we're going back to this idea of social determinants of mental health. We are seeing a lot of xenophobia being illuminated, a lot of racism being illuminated, a lot of past trauma being illuminated, and we are not exempt from vicarious trauma. We're not. That's just the reality of it. And so we're experiencing it, and we're, as everybody on the panel identifies as women of color, as people of color, that takes an additional emotional toll on you, having to manage the experiences of your clients and your patients, but then also having to live it yourself. I know personally seeing the disproportionate rates of Black people dying because of pre-existing conditions, because of the inherent biases, has been harder to manage. So I want to offer, our clinicians some tool of self-care who may be dealing with vicarious trauma, who may be the extra tax of having to manage these reactions. What do we offer them? What do we give them? Aside from saying, we see you and we get it and we're holding it, but is there any tool or self-care practice we can offer them during this time where they themselves may be having secondary, tertiary vicarious trauma?
This was big and it's hard, but I'm so glad you asked, because it's present. It's present in a lot of people's lives. So with this vicarious trauma and vicarious anxiety, I think this really underscores the importance of self-care. So if I were to give clinicians something, it would be a reframe of self-care in general. A lot of times you hear, take care of yourself so you can take care of everyone else. True. But I say, take care of yourself, full stop, period. As a radical act of countering the narrative that taking care of others has to look like martyrdom. It doesn't. So take care of yourself, period. And then the work you're doing after you take care of yourself, because we are the tool. It's not a scalpel for a surgeon or paint for an artist. We are the tool. So our ability to listen and to judge and perceive and discern what's happening has to be clear, has to be
That's good.
all well hands on deck right now. So that's the reason why we should take care of ourselves. And then when we do, all the work that we do is a drop in the pail that is going to one day turn the tide of these oppressions. And so know that what you're doing is meaningful, know that it matters and it counts, and it's a ripple effect. I really do believe in the ripple effect. So make your ripple effect.
I like that. Take care of yourself, period. You don't have to be in water during this time. You want to add something?
Continue to gather, right? That we've got to share mutual aid resources. You don't have to do it all by yourself. We all have a lot to learn, and that's okay. And just keeping in mind that this is a marathon, not a sprint. So also pace things out.
To that marathon analogy, pass the baton. Know when you need to tag someone in.
I like that. It's this idea that give yourself permission to be tired. That's what I would add. Give yourself permission to be tired and fatigued. And I love this metaphor. We don't have a scalpel. We are the instrument. Right. And so only if I am, healthy and well, can I then be an instrument of healing or insight or intervention for someone else. And so we have to kind of honor our humanity in that. And so take care of yourselves, pass the baton when necessary, take a break when necessary. I shout out to my boss, who I think is present, Amy Wilkerson. I said, I need a mental health day, and I'm going to take a mental health day because this is hard work. So I've thoroughly enjoyed being here with you ladies, just kind of reflecting on what's been on the front line of COVID-19 and how we're coping with it. I hope that we've been able to offer you all something to think about, considerations of the social determinants of mental health, some of the institutional racism, xenophobia that has been illuminated during this time. I hope that we are adapting our practices to be able to meet those challenges and name that. And I also hope that we are being mindful and taking care of ourselves, because that's essential and critical during this time. All right. We will see you all next time.
Enjoy the next panel.
Yes.
Thanks. To our next panel.